Hello, my name is Hilda Martinez, and today I'm going to be explaining the pathophysiology and etiology of the Parkinson's disease. So, Parkinson's disease is a neurodegenerative disease that is mostly presented in a patient through bradykinesia, which is basically a fancy word of saying small, slowing movements. Other symptoms of this disease can also be a resting tremor, whether it's typically seen in hands. So our hands appear to have this resting tremor. It can also be seen in our lower extremities, so in our legs. And another word for this is also just kind of a rigidity movement. Another typical symptom and presentation of the patient is if the patient is seen when walking kind of in a slow shuffling, narrow base pattern. That is a typical Parkinson's disease symptom. This disease is mainly based within the midbrain part of our brain. It's caused due to lack of dopamine cells created in our brain. So the lack of dopamine cells cause a disruption, which begins to kind of decrease our motor symptoms. So it starts off with, just like how I had said earlier, those voluntary movements become slower, they become more rigidity, and all of that is just due to the lack of dopamine that's being produced in our midbrain, which allows us to kind of send those signals that we need for our motor voluntary movement, and also even our mental movement. Eventually, Parkinson's disease also can cause a diagnosis of different mood dysfunction, sleep dysfunction, and even just unaware of kind of cognitive whereabouts, or just one's cognitive mind is becoming to also slow down. So it's a disease that kind of slowly attacks the body, and it's just typical for a patient to progress with the disease. As the patient does get older, it does become progressive. There is no cure, unfortunately, for Parkinson's disease, but there is medication to maintain within the disease and just kind of allow tremors to lessen, allow just any type of discomfort the patient has to become less. But yes, typically this is seen at least averagely in the population of the age over 60 is kind of more of a typical patient for this disease. But if you have any further questions or would like to know more about disease, please feel free to go ahead and ask, and I'll be more than gladly to inform you.